Welcome to Diabetes Day by Day, the American Diabetes Association's official podcast. I'm Dr. Neil Skolnik, professor of family and community medicine in the Sidney Kimmel Medical College of Thomas Jefferson University, and joining me is my co-host.
I'm Dr. Sarah Wettergreen, an assistant professor in the Department of Clinical Pharmacy at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences. In this role, I practice as an ambulatory care clinical pharmacist at the UC Health Lone Tree Primary Care Clinic.
Today's episode is incredibly important. We're going to be talking about the support that people with diabetes can access because no one goes it alone. It's important to have that doctor or nurse practitioner or physician assistant that you see, but that alone isn't enough. And that's why we've titled this episode, It Takes a Village. Diabetes management is complex. You need the right medicines, you need the right diet, the right physical activity plan, and possibly most importantly, the right attitude, because it's not easy. And you don't have to go it alone. So today we've invited members of the diabetes team to discuss the importance of what they have to offer. If you don't know what's available, you can't reach out to people, right, Sarah?
That's exactly right, Neil. I think of diabetes management almost like a puzzle. There's so many different pieces, and sometimes people might need some help bringing all those pieces together in just the right way. And there's nothing wrong with that. It's great to ask for help when you need it. I think, like you said, many people might first think about their primary care provider as a resource for diabetes management, but there are certainly many other members of the care team that can help.
There sure are. We know medicines play an important role in diabetes, but that isn't where things end. To get us started, Sarah, can you tell us about what pharmacists do to support patients with diabetes?
Absolutely. In my role as a clinical pharmacist in the primary care setting, I work with many people living with diabetes. I have something called a collaborative practice agreement, and that allows me to start, stop, or adjust the dose of medications used for diabetes, such as insulin or metformin. I can also order labs and glucose monitoring devices to help patients track changes in their glucose.
You know, it's fascinating. More and more in medicine, we're moving toward a team-based approach where people like myself will collaborate with people like you who have deep expertise in the medicines. And it really is a role and a way of care that works well. Are there pharmacists, though, with roles like yours in all primary care offices?
No, there are not. The role of pharmacists in primary care clinical settings is definitely becoming more common, but it's not universal. So if someone who has a diabetes diagnosis is looking to find a pharmacist to get this sort of help, they might want to start in their community pharmacy setting if they don't have a pharmacist within their other care settings available. Regardless of where a pharmacist is practicing, they can help people living with diabetes to better understand their medications, monitor for side effects, and help learn how to use the different devices used in diabetes care, like different medication delivery devices or glucose monitoring devices. But pharmacists are just one member of the care team. I'd like to start off by introducing a critical member of the diabetes care team, and that is the Certified Diabetes Care and Education Specialist, or CDCES. Joining us to tell us a bit more about this role today is Dawn Noe, RDN, LD, CDCES, who is a Certified Diabetes Care and Education Specialist at Noe Nutrition and Consulting. Welcome, Dawn.
Hi, thank you for having me.
Thanks for being here today to share a little bit more about your role. So can you tell us a little bit more about what a diabetes care and education specialist can offer to people with diabetes?
Absolutely. I always am amazed by the number of people who live with diabetes who have not actually seen a diabetes care and education specialist. And we were formerly called certified diabetes educators, but we really changed the name of our profession to enhance what we actually do with people living with diabetes, which is that we don't just educate, we actually are critical members of the care team. And so it's actually part of the standards of care that every person living with diabetes should see a diabetes care and education specialist at diagnosis, and at least annually. And we do a lot of different things, but one of the things that we do is we really help answer those questions that everyone who gets that diagnosis of diabetes has. From, is this curable, to how often should I check my blood sugar, to what do I eat, to all of those in between things. And what I always kind of remember or like to share with people is that most of the living with diabetes is done outside of the doctor's office. So it's so critical that there is a resource person and a support person that people have access to when they have all these questions that we know that they're going to have.
Yes, exactly right. I think having a point person to go to when those questions come up that we know will come up is such an important resource. So, like you said, many people living with diabetes haven't ever met with a diabetes care and education specialist. So, how can someone find someone with a CDCES certification to get that education?
Yeah, that's a great question. So it used to be that there were what I would say traditional diabetes education programs at most hospitals. Unfortunately, that's not necessarily true anymore, but what you are seeing is that the certified diabetes care and education specialist is often moving into new roles where they may be working even in a primary care doctor's office or in a virtual health clinic. That's probably the future, but I would say traditional diabetes care happened in an outpatient setting, usually in a hospital outpatient setting. And often diabetes care and education was done through like a series of classes. While I do still believe in that model, and I do want people with diabetes to be able to attend, maybe formal classes, I don't know that I think that that's really the future anymore. And also we were very limited, those were always during the daytime hours when people were working. So the beauty maybe in a post-COVID world is that we do have the option to do things virtually. And that's really where my passion is that ability to connect with people with diabetes, maybe not so much in that traditional outpatient hospital setting, but that you may be able to find access to a diabetes care and education specialist, not just from an 8 to 5 in an outpatient setting these days.
It sounds like accessibility is definitely improving for diabetes care and education. Is there a recommended frequency that you would suggest for people to see you?
So there are definitely what is considered the 4 critical times to see a diabetes care and education specialist. So that's going to be at diagnosis, annually, and then anytime that there's any kind of complication that occur or any kind of transition or change in life circumstance. And while I would say to me, those are kind of the minimum, I'm really a huge advocate of the more we have contact with the person with diabetes, the better that person with diabetes is probably going to do, because they get that opportunity to ask all those questions and also get that in between visit support. We also recommend for nutrition with diabetes that people are seen through a series of visits, potentially 3 to 6 times in the first months of diagnosis. And that's often not shared. So I wanted to make sure I shared that today.
It's incredibly important. And what a certified diabetes care and education specialist has to offer is fundamentally an empowered patient. And an empowered patient is someone who takes control of their own care. It is always amazing to me when I look at the studies, and we so often focus on A1Cs, that by changing no medicines, but having that experience with someone like you, often what patients get is a drop in their A1C that is the equivalent of what you get when adding an additional medicine. So it's so critically important. Let's go on. We're going to next talk to Laura Hieronymous, who is trained as a nurse and has her doctorate in nursing and is currently serving as the ADA Vice President of Healthcare Programs, which is pretty impressive. Laura, welcome to our podcast. Can you give us some insights first into the importance of nursing and what nurses offer our patients with diabetes?
Well, as you mentioned, I'm a registered nurse by trade. I have spent the majority of my 30-plus career as a diabetes care and education specialist. I have a couple of certifications in diabetes care and education, and really part of that interdisciplinary team that works with people with diabetes. And we do and promote the diabetes self-management skills that are so important, such as healthy coping, healthy eating, being active, taking medication, monitoring, risk reduction, as well as problem solving. And if you think about it, that's a lot of self-management skills. And if you think about just one of them, I'll use monitoring for an example. In monitoring, then there's a whole number of monitoring devices. There's blood glucose monitoring, there's continuous glucose monitoring. So we need to be experts in all of those areas so that we can really accept the patient where they are and help them find what works best for them. And I must say that people with diabetes need to understand that medical management for diabetes, any type, without education is inadequate. Data show, as you mentioned earlier, that it works to help people with diabetes achieve optimal outcomes.
I'm so happy to hear you say that, because just I know one of the things that you care about is patients being an active participant in their own care. Any hints that you might have about when a patient goes to see their primary care clinician, talks to the nurse or the certified diabetes care and education specialist, how they can lead their visit in the right direction?
So I think it's important early on for us as diabetes care and education specialists to ask the patient what they want to talk about, what they want to discuss, what are their needs, and understand that they're a key part of the diabetes care team. In fact, they're the ones that take care of themselves 95% of the time. So very important to just ask.
Isn't that's always the toughest thing to do, is sometimes to be a little quiet after asking a question and listen to what someone's needs are. Thanks so much, Laura.
I agree. That's certainly very important, Neil. And we've already talked to so many members of our team here, but we have even more support for our people living with diabetes. So next up, I'd like to speak with Viola Holmes, who is a registered dietitian and a certified diabetes care and education specialist. She serves as the Associate Director of Nutrition at the ADA and is certainly able to speak to us about what the role of a dietitian is. Welcome, Viola.
Thank you, Sarah. So as a member of the healthcare team, the registered dietitian and nutrition also, is an integral part to help the individuals with diabetes learn how to self-management. There's 7 areas of self-care management, and often the RD may focus on healthy eating and being active, those 2 behaviors with the individuals, to help them, to educate them, to support them, and to help guide them into making the best nutrition and lifestyle choices for their health. And we always use a whole person approach to provide individualized nutrition care that's based on their lifestyle, their beliefs, culture, personal preferences, and what they would like to do. That's extremely important to us, that we provide individualized care. And medical nutrition therapy is a key component of diabetes education and management. We call it M&T often, but it's defined as nutrition-based treatment provided by a registered dietitian nutrition. It includes nutrition diagnosis, as well as therapeutic and counseling services to help manage diabetes.
As a pharmacist working with patients living with diabetes, I feel like the question I always get is, what should I eat? And you're so right that there's not just one diet that works for everybody or one eating pattern. There's so many different elements that go into that. So it's such an important resource.
And often, patients, they come in and they still feel like they just want that diet, or they need that, prescription. And so we really have to talk them into realizing that it's not a prescriptive eating plan anymore. Maybe once upon a time it was, but we want to individualize it and make this something that they can live with and do long term.
I'm fascinated. It reminds me of something Laura just said. It's asking a question, then listening. What are you looking for? What works for you? What are your habits? And then meshing that with the knowledge that you have to come up with a way forward for patients. Is that right?
Absolutely. You hit it head on.
Let's now move on. Thanks so much, Viola, for joining us. Our next guest is Dr. Fatima Qureshi. Dr. Qureshi is trained in medical optometry and eye surgery and is based at the LaHaye Total Eye Care and Surgery Center in Louisiana. Welcome, Dr. Qureshi.
Hi, thank you.
Can you tell us about why seeing an eye doctor is important for people with diabetes?
Whether it's diabetes or any systemic disease, it's very important to see your eye care professional or eye specialist because there's so many diseases that first appear in the eyes. So from the eyes, you can see the complications that are happening in the rest of the body. So for diabetes, there may be retinal complications. That could be diabetic retinopathy going on. There could be macular diseases. There could be cataract developing in the lens. There could also be refractive errors that the patient's vision is changing frequently because of poorly controlled diabetes. So diabetes as a whole is not just affecting the kidneys, the heart, the nervous system, the peripheral nerves, but also affecting the eyes. And as an eye provider, eye specialist, and also trained as a physician, I get to see the big picture. So through the eyes, I'm looking at diabetes, hypertension, high cholesterol, and so on and so forth.
Yeah, and the eyes really give us insight into what is going on often in the vascular system in general. I've had a number of times where the eye doctor is the first one to recognize the degree of vascular disease that a patient has. So clearly, people with diabetes are at high risk for retinopathy and other eye problems. They need to see eye doctors regularly. Can you clarify for us the difference between an optometrist and an ophthalmologist? And most important for our discussion,
Yes.
is either one able to carry out what's needed in an eye exam for someone with diabetes?
Absolutely. So a great question because a lot of patients get confused with the two terms. So technically, an optometrist goes to an optometry school and they graduate to become eye doctors. They are fully trained in diagnosing and treating a lot of medical pathologies or medical conditions. So they can dilate the eyes, they can look for retinopathy, they can treat glaucoma, and then the ophthalmologist goes to medical school, and then they get trained in subspecialties. An optometrist doesn't need to have a residency, whereas an ophthalmologist has to go to residency, and then fellowship is optional for an optometrist. As well as for ophthalmologists. So both of them are absolutely qualified to check the eyes, dilate them, and then give education to the patients, which is very important when it comes to diabetes, because a lot of these things can be controlled with a good diet and exercise and medication plan.
So for regular routine eye care, either an optometrist or an ophthalmologist are appropriate people to make appointments for to get that eye care. Is there any recommended frequency for people with diabetes?
Yes. So yes, for the initial eye exam, either optometrist, OD, or ophthalmologist, MD can see the patients. And then depending on the complications, like let's say there is a severe diabetic retinopathy happening with severe macular edema, then of course, both of them have to refer the patient to a retina specialist. But in general, if the patient comes in for a full dilated eye exam and is diabetic, and we see that the retina is looking good, there's no maculopathy seen or retinopathy seen, then we just say, okay, come back in a year, for a full dilated exam. We can do some tests on them, such as optos. We can do OCT testing on them as well. Now, if we notice mild to moderate diabetic retinopathy, then we're going to say maybe they can come back within 3 to 6 months. If it's severe diabetic retinopathy, then of course we're going to see them sooner.
So that's so helpful. So for most people, for everyone, essentially with
Hmm.
diabetes, they ought to be seeing an eye
Hmm.
specialist at least annually. And then depending on whether they have other complex eye disease, the eye specialist will let them know the frequency that individually they need to follow up with. Dr. Qureshi, thank you so much for joining us.
Thank you. Great talking to you.
Our next guest is Aaron Sutton, who is a licensed clinical social worker and is an adjunct clinical assistant professor in the Department of Family and Community Medicine at the Sidney Kimmel Medical College of Thomas Jefferson University. Aaron, thanks for joining us.
Dr. Skolnik, it's a pleasure. Thank you for having me.
Can you talk to us about when a behavioral specialist should be involved for people with diabetes? When should someone reach out to you?
Yeah, it's well known that people with diabetes are 2 to 3 times more likely to have depression than those who don't. Anxiety, not quite as high, but I think, what really when we talk about diabetes and mental health is what's known as diabetes distress. And when we're talking about diabetes distress, this is the day-to-day toll that diabetes takes on us, right? Not only physically, but mentally as well. So we want to make sure as we're addressing, a person as a whole, that we're talking about their mental health. So whenever we start to feel symptoms of, could be depression, could be anxiety, but it could also be this overwhelming stress from diabetes distress, we should reach out to a mental health professional.
I think that's so helpful. If you think about it, depression has a prevalence of about 12% of the population. It's about double that in people with diabetes. You're dealing with so much. And I love the way that you distinguish between depression per se, but you don't need depression or anxiety as a diagnosis to benefit from a behavioral health specialist service. Diabetes distress is pretty darn prevalent. And even things like, can you put in perspective, are there ways that you can offer help for people who just have trouble complying with their diet, taking their medicines, keeping up with their exercise regimen? Are there behavioral approaches that might even be helpful for those common things?
There are many approaches, Neil, and the American Diabetes Association has a wonderful mental health directory that people with diabetes can utilize. And you can actually break it down by specialty. So if you would like to see a licensed clinical social worker like myself, or a licensed psychologist, or if you're looking for somebody who has a specialty in pediatrics with diabetes, they're all listed there in a great search criteria. And it's broken down by where people are, so you can find somebody close to you. And all of these professionals are trained and have completed the ADA requirements to be listed in the mental health directory. So you can reach out to them and you can schedule with that and you can talk about what you're going through.
That is so helpful. You answered the question I was going to ask next is how do you find someone who has the ability to do it? There's a number of specialties that do. Aaron Sutton, thank you so much for joining us.
My pleasure, Dr. Scott. Thank you.
Let's move on to what I think might be, I hesitate to say the most important member of the team. The person with diabetes is the most important member of the team, but maybe the second most important member of the team is a caring family member. And representing caring family members, I'd like to welcome Jordan Burkey. Jordan?
Hello.
Yeah, thank you so much for joining us. Can you share with us the perspective from which you approach being a family member of someone with diabetes?
Sure. Well, first, thank you so much for having me. Both my wife and myself have diabetes, and we've been living with it for a while now. Dr. Skolnik, as our primary care physician, has been paramount in terms of helping us understand diabetes and sort of work nonstop to stay in control of it. But we are we are crucial to each other in staying on top of it. Whether it's keeping each other in check as far as eating habits go, or looking for sustainable exercise routines and alternatives, we always have to be there for each other, supporting, understanding, cheering each other on without being, critical or judgmental.
Jordan, can I ask you something?
Yeah.
There must be times for you or your wife where you get a bit discouraged. I mean, this
hmm
is hard. This is an all the time thing. How important is it to have someone there who understands you, is there to support you?
Yeah, I mean, that's really important because we've been dealing with this for quite a long time, and not everything works. You've got to go at it like many of you have said already. You've got to go at this from a multi-pronged approach. And so whether it's, there's the medicine aspect of it, and that's been very important, but there's also the physical activity, and there's diet. It's not just a one thing that takes care of it. Uh, she has to keep me on top of medicine. Did you take your medicine? Have you taken your pills? But at the same time, she always forgets that we have a shot to take on Sunday mornings because she hates it. She says it feels like a bee sting every time. So I have to actually give her shot, and I have to rub her arm before, and I have to rub her arm after. But it's the only way that we get through that. And staying active is a huge part too. And it's funny because as we've gotten older, we're both over 50 now. We've tried all kinds of routines, walking, exercise equipment at home. Things have worked for a while, and then we've just sort of soured on them. Swimming. It was very unsettling to find out that I can't really swim too well anymore. I learned to swim in a different body than I have now with my BMI. And so I just can't do it. It's very odd. But our latest success has been biking. And so it started when she got a 3-wheel bicycle with a basket. She rides it to the post office, to the store. And so that's worked out really well. So it's just always looking for what works for us now, adapting.
Jordan, thank you so much. And I see the two of you over time and how supportive you've been through so many different things. And your point about how a journey is just that. It's not a walk down a straight path, but it is
Mhm.
always a curved path. And I think it was Proust who said, life is a walk through a wilderness that no one can lead us through but ourselves. Um, Thanks so much for joining us, Jordan.
My pleasure.
Sarah, this is such important information, and hopefully we've given our listeners enough information that when they talk to their primary care providers, that they can also be one of the people directing their own care. I'd like to do this or that. That's why as we talked in the beginning, it takes a village. We need to work together. As many people as we've talked to already today on this podcast, there's still others. People with diabetes should regularly see a podiatrist, a dentist. Doesn't hurt to enlist the help of a fitness professional. Sarah, any thoughts you have?
If I think about people living with diabetes, and especially as we went through that phase of a pandemic and maybe some people were disconnected from care, hopefully hearing from all the numerous voices and hearing from our care team today can really see that it takes a village, and there is this village that's here to support you. So even though you're managing as a patient most of the time diabetes on your own, it's something that you feel very independent in, and hopefully others are helping to build you up in that. You don't need to feel alone in that journey, because there really is this whole team of individuals who is there and ready to support you.
That is great, Sarah. We're all here to help you. Diabetes is complicated. Knowing the resources and using them is important to good care. I want to thank everybody who joined us today. And for the American Diabetes Association, I'm Dr. Neil Skolnik. Thanks for joining us, and tuning next month, where we're going to talk about some big changes that have been going on in the field of diabetes.